is Maddie Larson, and this is my professional communication speech. Here's my audience. Imagine being injured and unable to walk without pain. You're feeling frustrated, scared, and unsure if you will fully recover. Now imagine meeting a physical therapist who barely looks at you, interrupts you, and ignores your concerns. Most patients would immediately feel uncomfortable and lose trust in their therapists. In healthcare professions, like physical therapy, communication can significantly affect a person's emotional well-being and their physical recovery. Everyone in this classroom will likely interact with a healthcare professional at some point, and understanding empathetic communication can improve relationships, increase trust, and better outcomes not only in healthcare but in everyday life. Today, I will explain why empathetic communication through active listening, emotional intelligence, and communication is essential for building trust and improving patient care in physical therapy. I am interested in becoming a physical therapist myself, so understanding effective communication is important for my future career. I also researched our class content along with professional healthcare sources discussing empathy, listening, and patient care. First, I will explain how active listening helps physical therapists. Second, I will explain how emotional intelligence and empathy improve patient relationships. Third, I will explain why nonverbal communication is essential in physical therapy. To begin, active listening is one of the most important communication skills a physical therapist can have. Patients often come into therapy feeling anxious, discouraged, or frustrated. They may be in pain or worried about if they will fully recover. Because of this, therapists can truly listen and understand what the patient is experiencing. In our class content, Chapter 6 is described as using the eyes, ears, and heart. With the eyes, healthcare providers observe nonverbal cues such as facial expressions and body language. With the ears, they hear words, tone, and speech patterns. With the heart, they understand the emotional meaning behind what the patient is saying. Effective listeners focus on understanding instead of judging. They avoid interrupting, consider the speaker's point of view, and ask questions to make sure they fully understand the message. In physical therapy, this is especially important because patients need to communicate clearly their pain levels, concerns, and progress during recovery. Research also supports the importance of active listening in healthcare. In the article, Role of Active Listening in Cultural Competence, researchers explain that active listening improves empathy, emotional regulation, and communication skills in the medical professionals. When patients feel heard, they are more likely to trust their therapist and follow treatment plans. Listening becomes even more important in emotional, challenging healthcare environments. A therapist who listens patiently and responds with understanding can provide emotional support in addition to physical treatment. Emotional intelligence is the ability to recognize and manage emotions in ourselves and in others. In Chapter 7 of our class content, emotional intelligence and social intelligence are described as important skills for building relationships and communicating effectively. In physical therapy, therapists must recognize when patients feel discouraged, embarrassed, or overwhelmed. Recovery can be physically exhausting and emotionally draining. Responding with empathy can help patients feel supported, motivated, and understood. Trust is also a major communication in healthcare. Patients who trust their therapist are more likely to participate in treatment and stay connected to recovery. Without trust, patients may feel uncomfortable, unmotivated, and unwilling to communicate honestly about their condition. Mary Ritchie's book, Nonverbal Communication Today, explains that every human being is a thinking, feeling, and unique individual who experiences communication differently. This means every patient enters therapy with different fears, emotions, and expectations. Physical therapists need to understand and respect those differences while working with patients. Ritchie also explains that communication is always relational and emotional because people create reactions and responses based on their interactions with others. In physical therapy, every interaction can shape a patient's comfort level and motivation. When therapists communicate with empathy, they create positive emotional experiences that support healing. Another important concept from Chapter 8 is emotional contagion. For example, if a therapist remains calm, encouraging, and positive, patients may begin to feel less anxious and more confident. Positive emotional communication can directly influence a patient's recovery experience. Along with emotional intelligence, nonverbal communication also plays a major role in how physical therapists connect with patients. Nonverbal communication includes eye contact, facial expressions, and posture, gestures, and tone of voice. According to Chapter 5 of our class content, nonverbal messages help form relationships and express emotions. In physical therapy, these behaviors can strongly affect how patients feel during treatment. For example, maintaining eye contact and using positive facial expressions can communicate care, attention, and respect. Open and welcoming body language helps patients feel comfortable and safe. But on the other hand, avoiding eye contact or showing closed-off body language, it can create distance and discomfort. Nonverbal communication also works together with verbal communication. A therapist's tone of voice shows patience, encouragement, and understanding. Physical therapists also rely on nonverbal communication to guide conversations and to create professional relationships. During my interview research, I learned how important body language and active engagement are in the healthcare settings. According to Concordia University, strong listening, problem solving, and communication skills help professionals build effective workplace relationships. These skills are important in healthcare because physical therapists must communicate not only with patients, but also with doctors, nurses, and other healthcare providers and professionals. Overall, empathetic communication in physical therapy depends on listening, emotional awareness, and nonverbal behavior working together. Today, I explained how active listening helps physical therapists understand patients. I also discussed how emotional intelligence and empathy improve patient relationships and recovery outcomes. Finally, I explained how nonverbal communication supports trust and effective care. Empathetic communication through active listening, emotional intelligence, and nonverbal communication is essential for building trust and improving patient care in physical therapy. Patients may forget specific exercises or treatment plans, but they will always remember how they were treated and how they felt during recovery. In physical therapy, communication is not just a professional skill, it is an important part of healing both the body and the mind. Thank you.